Good evening and welcome to the Lutronic eCO2 Virtual User Summit, moderated by Dr. Omar Ibrahimi and featuring panelists Dr. Zena Gabriel, Dr. Jacob Steger, and Dr. Jill Weibel. We are extremely grateful for all of you joining us for a robust program of information and discussion on how to maximize the capabilities of your eCO2 laser platform. We appreciate our customers and their devotion to creating premium results while maintaining happy patients for life. At Lutronic, we are committed to offering ongoing educational opportunities, and we believe there's no better way to do that than through conversations with our experienced, talented, world-renowned practitioners. We are very lucky to have 4 of them on our panel this evening. Here's what to expect in this session. In a few moments, Dr. Ibrahimi will present a brief overview of CO2 resurfacing, as well as the finer points of Lutronic's eCO2 laser platform and why it's the top ablative resurfacing device on the market. Next, you will hear from our esteemed expert panel as they discuss several actual eCO2 cases from their portfolios. They will discuss protocols, settings, treatment pearls, lessons learned, all while answering questions along the way. Type your questions into the Q&A box at any time. The panel will address as many as possible, but due to the high volume of virtual attendees, we may not get to every one of them. Don't worry, if we aren't able to get to your question, a Lutronic representative will follow up shortly. This session will be recorded and made available on demand. You will meet all the panelists shortly, but without further ado, please allow me to introduce our esteemed moderator, Dr. Omar A. Ibrahimi, the founder and medical director of the Connecticut Skin Institute. Dr. Ibrahimi is a board-certified dermatologist who has completed advanced fellowship training in skin cancer, laser, and cosmetic surgery. He is one of the foremost physicians in the diagnosis and treatment of skin cancer, as well as medical and cosmetic issues involving the skin. He is a graduate of the rigorous MD-PhD program at the NYU School of Medicine and completed his dermatology training at Harvard Medical School while also working at Massachusetts General Hospital and several other renowned Boston area medical institutions. Dr. Ibrahimi completed his fellowship program at the University of California, Davis. Dr. Ibrahimi is accredited by the American College of Mohs Surgery, the American Society for Dermatologic Surgery, the American Academy of Dermatology, and the American Society for Lasers and Surgery Medicine, for which he is also a member of their board of directors. He has been an invited speaker at numerous national meetings and has published many articles on skin cancer surgery, laser and cosmetic procedures in leading medical journals, and has performed thousands of these procedures. Dr. Ibrahimi has served as a visiting associate professor of dermatology at Harvard Medical School and the Wellman Center for Photomedicine, which is the world's leading research center where the majority of today's laser and cosmetic technologies were invented and tested. We are honored and very grateful to have him hosting for us this evening. And on that note, I will turn the session over to Dr. Ibrahimi. Sir, please take it away.
Great. Thank you so much, Dan. I think we ran close to the 90-minute limit with that introduction, but I appreciate it. I'm also grateful to Lutronic because this gets me out of the house with my 2 crazy kids who should be going to bed sometime around now. But no, in all seriousness, I'm very excited to be hosting this with a very distinguished panel of diverse physicians. And the eCO2 is actually one of my favorite devices from Lutronic. I've been using it since 2012, and it's really kind of a hidden gem. I know much of the attention has been on another great product, the Genius, but this one is equally a great MVP in my practice, and I'm really excited to spend the next hour and a half talking to you about it with this distinguished panel of physicians. So this is a really unique value proposition in terms of devices. It's a best-in-class fractional ablative resurfacing device that has a patented blending called Control Chaos, which we'll get into more detail later on in the talk. It actually comes with these tips that have different spot sizes for the ablative fractional channels, and they're basically magnets, so you can change the spot size literally within 5 seconds. My favorite thing about this device is, in addition to being able to treat a variety of conditions, is that it comes with a lot of built-in intelligent care. So at the end of this tip, there's a skin sensor. So it makes sure that the tip is actually in contact with the skin before the laser is allowed to fire. And even more importantly, it doesn't come with a consumable. So I am really happy because the return on investment is very quick with this kind of device, and I have no problem getting a device or using a device that has a consumable if it's a quality one. But I think it's the icing on the cake when you have an excellent device and there's no consumable. So here's a photo of the device. It's got a really nice, sleek footprint, and it's really elegant, state of the art. It uses a sealed RF laser tube to generate the CO2 laser. This, in general, is what helps it be such a reliable, stable device. I've had this in my practice for several years without any functional issues, without any need to call service. It's really kind of a super reliable device. It's also got really good ergonomics. So there's a nice counterbalanced arm, which is great because if you're doing long procedures where you're delivering many pulses, this will minimize your fatigue, and it gives you great kind of control over the handpiece. So I think I mentioned the touch screen. It's very interactive, user-friendly. You can adjust it to look if you're sitting down or standing, so that there's no reflectance or inability to see the screen. And we talked about the ergonomic handpiece. The tips, again, there's no consumable. You can pull the tip off. It's magnetic based, and you can change the spot size very easily. There's a variety of scanner shapes, so you can deliver your pulses as circles, as squares, as triangles. You can even deliver a single spot if you wanted to. And then one of the most amazing things about this is the controlled chaos technology, which I'm going to show you. And then also there's a couple of modes, dynamic and static mode. And I'll show you why that's so important in helping you deliver a really nice, effective, clean treatment to the patient. So, so this is a device with a broad range of indications. What I use it mostly for in my practice is skin resurfacing and treating scars, wrinkles. You can also use it to treat photoaging, dyschromia, photo damage with pigmented lesions like lentigines, precancerous lesions, non-melanoma skin cancers, and then there's some nice uses which are not cleared in the United States, but things like drug delivery, and I'm sure Dr. Weibel and I will be talking back and forth about this quite a bit because she's one of the foremost experts in this in the world. So as I said, there's a variety of conditions that you can treat, and you can pick your tip based on what you're trying to treat. So if you're looking to treat something like photo damage and benign pigmented lesions, that's where you're going to pick the tip that has the larger spot size and the beam size, and use low energies and high densities to get a high % coverage. And you can see this nice result before and after a treatment. If you're going more after kind of tone, texture, and fine wrinkles, you're going to use the medium or the 300 micron spot tip. And again, this is going to give you moderate energy and moderate density, but really nice for rejuvenation. And then if you're treating things like deep rhytids or scars, you're going to use the small beam size tip, which is the 120 micron tip. And typically when you're treating deep scars, you want to use high energy and low density, and you can see an amazing result here. So let's delve a little deper into the device. So this is kind of the user interface when you turn on the device, and it's pretty intuitive. So you can control your pulse energy over here. You can control your density over here. This is the standby ready mode. This is the total energy that's used, and you can reset it in between cases. This is where you set the power. This is where you can pick the type of spot. So as I said, you can pick a circular spot, a square spot, a rectangle, a triangle. This is really nice when you're doing something, say, around the mouth or a circular area where you might need to kind of use a triangle or blend to some of the curves that occur on the face or on the body. This over here tells you what type of tip that you have on the device. And then there's static and dynamic modes, which we'll get into a little bit later. The patented control chaos technology. This is a really key, elegant way that the eCO2 helps maintain you delivering a much safer and comfortable treatment. And there's a couple of slides that follow on this that we'll go into more detail on. And again, as I mentioned, there is no consumable with this. So when you get the device, you're not having to buy or constantly pay per treatment. And so what that does is just help you recoup your investment much faster. Okay, so the control chaos technology. I want to spend a minute on this because this is a really key feature of the device. And so what happens with the fractional CO2 laser with the eCO2 is when you're delivering these pulses, you see how they're all kind of coming down in a random fashion. I'm going to go back and play that again. So typically most devices kind of deliver them in a linear fashion right next to each other. And when you're doing that, the CO2 wavelength is actually, when it's creating these little channels, there's also a little coagulation zone around the ablated hole where there's heat generated. And if you're laying these down next to each other, the heat is going to build up, and that's what's going to lead to delayed healing and unwanted side effects like post-inflammatory hyperpigmentation. It also makes the treatment much more uncomfortable. The control chaos actually gets around this issue, and so it helps you with safety, efficacy, and patient control. And here's just another view of it. You can see the pulses are kind of being laid down in a fashion that they're not being put down right next to each other. And so this doesn't hurt as much, and you're much less likely to get things like post-inflammatory hyperpigmentation, or you might hear me refer to it as PIH when I'm talking quickly. So these are most of the other laser companies that are using a stamping handpiece. When they're delivering their pulses, it comes down in this fashion. So you can see the pulses are all laid down right next to each other. And so this is where you can get kind of unwanted thermal heat buildup or bulk heating. And this is what causes that PIH or post-inflammatory hyperpigmentation. And then here's just another view, right? It's just kind of sequentially laying down right next to each other. So this is a really distinguishing feature of the eCO2 device. We talked about the fact that there's no consumable, and the handpiece is really easy to change. You can see here, basically you clip it on. There's a couple of magnets on the handpiece, and a couple of magnets on the spot size. So there's a nice connection that lines up, and then it instantly recognizes what size tip that you have on the user interface. So there's three main tips: the 120, the 300, and the 500. The 500 isn't currently offered in the US. So what do we use these things for? So the 120 tip, these are really small micro kind of spots or microablative channels. And typically you're doing these in relatively low density. You're doing things like treating scars or deep rhytids or wrinkles. And this often has a little bit more of a tightening effect because you're also getting a little bit of coagulation around each of these channels. And that little bit of coagulation also kind of does a little bit of collagen contraction and tightening. The 300 micron tip, these microablative channels are a little bit larger. You typically do these with a little higher density. When you're looking for clinical indications, these are more for kind of superficial texture or skin brightening. And then the 500 tip, which is not available in the US, but these are the larger kind of spots, and you can do this at much higher densities. And again, this is more for kind of skin tone, texture, and luminosity. So we talked about this feature. I think I briefly mentioned it, but I think it's an important one to mention again. This actually helps make me a better laser physician. There's a skin sensor here at the end of the tip, right? And so the laser won't fire unless the sensor is right up against the skin. So what it actually helps you do is, if you're holding it off the skin or high, you're actually not delivering the laser beam in an appropriate fashion to the skin. You're changing what's called the focal plane, and that might be a little bit too much of physics talk for the audience. But the skin sensor actually helps make sure that you're at the correct focal plane, and so that when you're delivering your laser energy, it's being done in a safe way that's not going to cause unwanted side effects based on the settings that you have dialed in. So this is a key feature of the eCO2 device. The healing from this is very quick. I'm going to go through some histology. As a dermatologist, I love looking at histology because it kind of tells you the effects of the laser on the skin. And this is using the 120 micron tip. And you can see what we call these deep microablative columns. So you can see basically the laser poked a hole into the skin, and you can see there's a little bit of coagulation surrounding the thermal area, and then just a little bit of plugging of proteinaceous material, and basically, literally within 24 to 48 hours, the area reepithelializes and this hold is closed, and so there's very fast wound healing as compared to when we used to do traditional fully ablative CO2 resurfacing. So here's another view. You can see these microablative channels. Here's a histology taken 2 days later, where you can see basically these holes are kind of plugged and capped. And so the healing is relatively fast. However, there is an inflammatory process that's a wound healing process that's occurring in the dermis, and what that's going to do is actually stimulate the production of more collagen. And so this is why we can use this to treat things like wrinkles and even get a little bit of a tightening effect with these lasers. And you can see at 14 days, basically the epidermis has gone back to a fully normal state. And you can see there's still, remodeling and a slightly inflammatory healing process that's going on in the dermis. But, from a clinical perspective, the healing about 7 to 14 days later, depending on how aggressive you're going, they're basically coming back to baseline in terms of appearance, and there's not much redness or swelling. So one of the nice things about the eCO2 that drew me to it was the Lutronic. The company put a lot of effort into getting these histologies and matching settings on the laser to what is happening actually to the tissue under the microscope. So if you want to drill your hole deeper into the skin, what you have to do is increase your pulse energy. And I'm going to show you a series of slides here. So we're going from 4 millijoules to 22 millijoules to 60 millijoules to 160 millijoules. And just by increasing that energy, we're going, from 100 microns to about 300 microns to almost a millimeter to 2.5 millimeters deep into the skin. And so, when it comes to fractional CO2 devices, this is pretty fantastic, and it's great because you can really get into those really thick, hypertrophic and keloid-like scars, and really get in there and induce remodeling and improve the appearance of them. Here's another histology. This is just a horizontal view. What we kind of saw before was more of an en face appearance. But what I like about this slide and what I take away from it is look at how uniform all these laser pulses are, all these microablative channels. They're all basically the same size, and it tells me that the device is giving even and consistent and reproducible results. And that's really, really key, because if your device is not reproducible and it's not consistent, when you're dialing something in, are you really getting what you're setting your device to or not? And that's something I always kind of worry about. But when I see a histology image like this, where I see the results are kind of consistent and reproducible, it's very reassuring to me. Here again, this is just kind of showing what we've seen in the last few slides, but basically as you increase your pulse energy, you're going to be able to go deeper and deeper and deeper. So, when you're approaching a patient, you kind of look at their clinical issue and think about it. So if there's a scar, we're going to probably set the pulse energy to be a little higher. If we're going after more tone or texture, we don't necessarily need to get 2.4 millimeters deep into the skin. We can probably get away with a lower pulse energy. Obviously, the lower the pulse energy, the less discomfort the patient's going to feel, right? If we're going deeper, it's going to hurt the patient more. So we only want to go deep as really what the clinical issue is when we're treating the patient. And I'm going to just skip through this in the interest of time, but this is, again, it's just basically showing as you increase the energy, the depth of the hole that you're drilling and the width of the hole that you're drilling increase, and also the thermal damage at the periphery of the hole also increases. This is the 300 micron tip, but the principle is the same. You increase the pulse energy, you're going to go deeper in. You can see here with the 300 micron tip, the width is a little bit larger, so you're ranging from about 260 to 420 microns. And then this is at 160 millijoules, and you're basically about 379 microns wide. So there's what we call a dual operation mode with the eCO2. I want to spend another minute on this because this is another, I think, distinguishing feature of this device. So this is the interface that you'll see on the screen when the device is on. And typically when I'm treating somebody for a scar or I'm doing a particularly more aggressive resurfacing, I'm typically in what's called static mode. And I'm laying down these pulses and I'm going side by side by side, and I'm delivering the energy. But no matter how good I think I am, I'm always going to have little skip areas in between my pulses where the skin doesn't get treated. And when I finish a treatment, I look for those areas, and then you kind of have to go back and figure out how to fill those in. What the eCO2 does is it helps you get around that by having this dynamic mode, okay? And basically what the dynamic mode, with the static mode, as I mentioned, you're kind of laying these pulses down, and if you're using a square spot, they go in this direction. The dynamic mode, you're actually holding the handpiece and you move it, and it's kind of delivering the pulses as you move the handpiece, as opposed to the static mode where you're holding it still and with the controlled chaos technology delivering all those microblade of columns. With the dynamic mode, you're moving it around. Let me show you this slide because I think this illustrates the concept a lot better. So say, this isn't mine, but say I did this treatment. You see all these areas where there's little skips where the spots aren't aligned. No matter how good you think you are, this is going to happen to any human being that's doing the treatment. Of course, with better technique, you can minimize this, but it happens. And when patients kind of see this, I think they kind of look at it as a negative because they look at it as a skip area or an area that the person that was doing the treatment missed. And when I finish my treatment in static mode, I go to dynamic mode and I basically paint over the face, moving the handpiece, and I fill in all these areas that were missed with the static mode. And you see here how you get a nice, even, kind of consistent treatment. So when the patient sees that, they're not seeing these skip areas and wondering like, oh, was the person in a rush? Was I the last patient of the day, or were they running late, et cetera, et cetera. They're getting a nice, even treatment, and I think they're feeling a lot better about this. And this is, I think, one of the subtle things about resurfacing, but really something that distinguishes people. And the eCO2 helps me be a better laser resurfacing physician because of this feature. So there's a variety of other features. So again, there's the controlled chaos technology, but if you wanted to lay down the pulses in the traditional kind of way, you could do it that way as well. You can control the wattage on this. I would say this is really for more advanced users. The density, the device provides you with the ability to lay down just a single microablative channel, just one, or you can, you can control the density with some of the tips up to and even theoretically over 100%. So there's a wide variety of density. The interval between the pulses, you can kind of control the amount of time in between each pulse. You can also do what's called, stacking. So you can hold the laser and you can have it fire 5 times or 3 times or 2 times if you'd like to. I tend not to really use that functionality, but it's nice to have it. We talked about the single point beam. And then you can, if you have settings that you like, you can save them to memory. So rather than dialing them in, you can just, hit your, your memory 1 setting or your memory 2 setting and just pull them up instantly. There's also a surgical handpiece, which I think probably for the folks that are much more surgically oriented, which is really popular, and it basically allows it to act like a scalpel. So you can do excisions, incisions. You can remove things like skin tags. People use these for their eyelid surgery incisions. You can treat dermatologic conditions like warts, syringomas. These are benign. People sometimes use them to treat precancerous lesions as well. It's a nice add-on to have on the handpiece, on the device platform. So with that, I know I've talked to you quite a bit about the specifics of the device and why I'm passionate. Just to kind of stimulate the discussion that we're going to have, I wanted to share a case of mine. I'm a dermatologist, so I treat a lot of skin cancer. I do have a large aesthetic practice, but what I really enjoy is treating medical conditions with lasers that make an impact on people's lives. And so here's a patient that came into me that has something called Rhinophyma. Rhinophyma is a condition, it's basically the end stage of rosacea. So rosacea that has not been managed or treated tends to develop into a condition where they're not only red, but the skin kind of thickens. And this is Rhinophyma, so it's phymatous changes on the nose, and you can see these kind of growths. And this can get sometimes so bad, these growths can get so big that sometimes the airway or the nostrils get impacted and these people can't breathe comfortably. And so I use the eCO2 device basically, and what I did was I used the larger tip to kind of shave down these lesions and do more kind of ablative resurfacing. And then once I kind of evened these out as much as I could, I used the 120 micron tip to basically thin the skin out. So remember, with Rhinophyma, the skin thickens up. This is a pretty aggressive procedure. This is 1 month after a single treatment. But when these patients leave, their skin is literally raw. It looks red and it's bleeding and it's raw. And it takes a couple of weeks to a month for it to even heal up. And then sometimes it stays erythematous or red for a while. But I always tell folks that if you have a device that can do powerful things like this, then it's, the cosmetic and the aesthetic stuff is often easier to do. And so if I can do something complicated like this, I know that the device is capable of doing a lot of aesthetic things. So I've been talking quite a bit. I know we have a wonderful panel of very distinguished physicians here, and they each contributed some really impressive cases. So what I'd like to do is just briefly introduce Dr. Gabriel, and maybe she can get her mic unmuted.
Hi, I'm here.
Hey, how are you? Great. So let me just introduce you and give the audience a little bit of background. So Dr. Zina Gabriel, she's a board certified dermatologist. She is a lifelong Californian. She graduated from UC Berkeley. She earned her medical degree at UC San Diego. And then she did her dermatology residency at USC. And so she's a California person through and through. She's got a wonderful practice in Southern California. She treats a lot of people with a variety needs, and you know, she's in a part of the country where I think sometimes patients are very demanding and have very limited downtime. So, you know, I'm really looking forward to kind of hearing, you know, the stories about these wonderful cases that she's shared. So welcome, Dr. Gabriel.
Thank you, Omar. Excellent presentation. I learned definitely a thing or two. One of the things I can say, I've had the eCO2 since 2009. And I remember when, you know, this was kind of before the surge of kind of sub-ablative lasers that came out. So, you know, back in the beginning, we had like an IPL and like erbium and CO2s. And like, what do you choose? And there wasn't a lot in between. And I always felt that the echo was just such a beautiful device. I think that you really nailed it on the head when you talked about the controlled chaos. I think that is brilliant technology because it does allow the skin to have its thermal relaxation and not overheat the tissue and end up with the pigmentation problems that we've seen with ablative devices. The other huge thing that I think is so important is, you know, I always, when I listen to some of these laser lectures, I always think, oh, the ergonomic thing's not that big of a deal. It actually is. This is such a fluid device. And when I do a full face CO2, it's incredibly easy. I don't know how to explain it, but to me, you know, the majority of the procedure is the numbing and the relaxing of the patient. And then once you do the procedure, it, you know, from static mode to dynamic mode, it's so easy. It's not awkward. You could move your wrist around. I think that's kind of something I tend to overlook. And then when I go to use my echo, I'm like, oh my gosh, this is the easiest laser. I think the interface is 100% foolproof. You don't really have to think too much about it. And the variation of pulses and shapes that you mentioned, Omar, is I think also huge because you're really kind of, it's so easy. It's right there and you're changing it to a circle or a triangle immediately. And there's not changing tips and changing arms. And it's just a really easy device to use. I will say that I have 9 lasers in my practice. And this is, as you said, I know we spent a lot of time talking about the microneedling and RF devices, but I think there's nothing that gives the results of an echo. And I think what speaks to it is your histology slides, Omar. When you look at the histology of what happens to tissue with that very specific depth of ablation and the neocollagen that's formed, nothing can compare to that. And when I look at my patients, I think all of us that are aesthetic doctors, a lot of it is determining, you know, what are the aesthetic goals of the patient? And, you know, we can talk all day about assessment and what the patient needs. And as dermatologists and plastic surgeons, we might look at someone and say, really, that lady needs a CO2, but she's not going to do it. She's a new patient in my practice. And so we end up kind of coaching people and walking them through this slow treadmill until they get to what they really need. And a lot of times with my assessments, with everyone on a panel, I think it'd be curious to hear how you guys do it. But if somebody is coming to me and they have, you know, moderate to severe rhytids, you know, I go straight for the echo, or at least I'll recommend it. But I definitely discuss, you know, that there's lighter treatments that you can do, but you're not going to get the results as you would with an ablative resurfacing like the echo. So interestingly, my first case is a woman who really was a low maintenance kind of real estate agent, local in Long Beach, California. Her son was getting married. And she came to me and said, I kind of have never done anything. I don't want to look fake. Believe it or not, the fear of unnatural results is still what limits most people. And, you know, what should I do? And in my assessment, I, you know, basically analyzed her skin from 4 standpoints: color, texture, volume, and elasticity. Those are the 4 features that I use to evaluate every skin type. And I told her, you have dynamic rhytids, so you definitely need a neuromodulator. You have static rhytids, like the accordion lines in the cheek, that you cannot get rid of unless we do something ablative. And you have volume loss. So your global volume loss is something that is going to need a filler. So basically for this case, I gave her a consultation and I said, you know, I think it's very interesting to point out that when you do subablative lasers, like, you know, whatever's on the market for something subablative, like Fraxel duals or whatever, a lot of people will hint, oh, you could do 3 of these to equal 1 CO2. And I think that's a misperception, because no matter how many subablative lasers I do, I never get the righted results that I do with the eCO2 device. And again, it has to do with that depth of ablation that is so specific with the Lutronic device, that you're getting, you know, 1.8 to 2 microns deep, and you really need to get past the papillary dermis to get that righted correction. So sure enough, this patient agreed to do the echo. We did do 2 vials of Sculptra about a month before her eCO2 procedure. And I did her Botox about 10 days before the procedure, making sure it was in the muscle before the CO2. I treated the patient with a month of retinols and hydroquinone. I always do that no matter how fair the patient is. You can see this patient is very fair. Fitzpatrick type 2, maybe even 1. And so I knew I could get aggressive on her. And I knew that I needed to give her results. The settings I used for this patient, I used the 120 micron tip. It's one of my favorite tips. I love that little magnet you mentioned, Dr. Ibrahimi. It's so easy to switch out. But I used the 120 micron chip because I knew I wanted to go deep. I did the full face with 100 millijoules and a density of 100. And in the rhytids here in the accordion lines, I actually turned my millijoules down to 80, and I did this whole patch and I stacked my pulses. So I did the whole face with a 100 millijoules and 100 density. And then in this area around the mouth and around the accordion lines, I turned my millijoules down to 80, but I did a pulsing stack ×2. And I kind of have the idea that it goes boom, boom, and you just get just a little deeper. Maybe I gave a little bit less energy when I lowered it from the 100 to 80, but I really get excellent results, particularly in the vertical lip lines and the accordion lines.
Amazing. It's a beautiful result.
Yeah, and she's really happy. The key thing, we spent a lot of time talking about post optimizing your laser treatment post-surgically by the microchannels of injury that you've created, you know, infusing the skin with powerful actives, whether it be PRP, vitamin C's, retinols, whatever it is, stem cells. We're really big on optimizing results because you have this kind of unique opportunity to deliver drugs, as you mentioned, in this fresh skin, and that histology is kind of wide open to stimulate collagen. So she got an amazing result. She's a really compliant patient. She did exactly what we said. And she felt happy that she didn't look over plumped and waxy and fake. So she was really happy.
No, it's beautiful. Zena, what was her downtime like?
Good question. So she did have about, I see my patients post-op day 2 and post-op day 7, assuming they have no, so essentially she's crusty. If I around those areas that I do the stacking, Omar, she does have some pinpoint bleeding. I know I'm in the sweet spot when I get my pinpoint bleeding. And so she had, for the first 48 to 72 hours, she has significant erythema and some oozing. Around like the 48-hour mark, they're basically epithelialized and they're just hyperemic. And then essentially you begin kind of the epithelialization process in a little bit of sloughing and bronzing day 4 through 6. By day 7, they're just pink and like ready to slap on some makeup. So it is a good solid 5 to 7 days of downtime. And it depends again on the depth and if I achieve pinpoint bleeding. When you get down to the papillary dermis and beyond and you're actually bleeding, you do see some serous exudate about 24 to 48 hours, but I don't go that deep on every patient.
Okay. Great. And, so this looks like she's a one and done. What would you, in an ideal world, would you tell her to do this on a yearly basis, or, what would she do next? Or when should she follow up with you next?
Good question. And I think that's so important because I have a card in my practice, guys, and it's a skincare card that you go home and the front of it says this: a laser treatment is only as good as your aftercare. Okay. And that's my quote. And then in the back, it tells you like how to care for your skin. For someone like this, I recommend, for someone like her, basically, this is going to last, the righted results are going to last her as long as she continues her retinols, her vitamin C's and glycolics for good pigment correction and basically, maintaining that kind of brown pigment control. And then keeping up with her dynamic rhytids is critical for the vertical lip lines and crow's feet. So I almost tell them, if you don't keep up with your neuromodulators, you're going to waste your money on your echo. Around about 18 months after this procedure, just for a buff and shine, I always recommend either a LaserMD, which is also electronic advice, and I love those procedures. I call them a quick buff and shine. And if you've spent significant amount of time in the sun and you're kind of being a bad girl or a bad patient, I might even do another light CO2 on you with a 300 tip, depending on the amount of pigment that you have not controlled. But this patient is really compliant. I think I did a LaserMD on her about a year and a half later. And the irony, I saw this patient today, she's moving to Florida. And she looked amazing. She's like, Dr. Gabriel, I think I want to do another laser before I go. And I said, you know what? You don't need it. You look so good. You don't need it. And I think that's one of the key things about what we do as ethical doctors. You don't just do something because they ask for it. So.
Awesome. Great. I think we have another view to share here that just, highlights how beautiful and amazing this result is.
Yeah, she was really happy. And I think the sculptor is big too, because I do think volume loss plays a point in laxity. But like you said, Omar, I do think you do get some tightening when you go deep and you get into that neocollagen. I see significant tightening of the skin when I'm using densities, or when I'm using millijoules of anywhere in the 100 range or above. I definitely get tightening of the skin.
Great. Well, we've spent so much time on this case, but it's such a beautiful result. I felt like, we really wanted to delve into this. So
thank you very much. I'll make the other ones quick.
No. So here's another great example. Why don't you tell us a little about this patient and what she was looking for and what your approach was with her?
So this woman was quite young, actually. She's only, I think she was 60 years old, 59, 60 at the time. She was really fair. She was a towhead, and she had been doing, all sorts of chemical peels and products, and she really didn't like her rhytids. And I said, honestly, the only thing that's really going to get rid of those accordion lines were the eCO2. And for this patient, I actually, because she was fair, I actually did 120 millijoules with a density of 100. So I kind of went, as we say, King Kong on her. And essentially, I got some great tightening of the lower eyelid, even some tightening of her neck. Her upper lip significantly improved, and you can even see it's thicker. This patient had no filler. I think she's a little heavier in the picture on the right-hand side, but she doesn't have filler in this face. So you got significant jowl improvement. The rhytids are, close to being gone in the accordion area. Even her crow's feet, it's kind of hard to appreciate the picture, but I do keep up on Botox in the upper lip for the vertical lip line contraction. And she was really happy too. Again, you can see one of the things to appreciate in this photo, quite remarkably, is her skin quality. She has a dullness, she has like a sallowness. She doesn't have a lot of pigmentation, but she does have kind of a sallowness, and you can see on the right-hand side just a beautiful luminosity of the tissue, a lot more light refraction, and she just, her pore structure improved. She looks amazing.
Yeah, and what I'm just struck by again is these accordion lines are just such a, painful thing for many of us to treat.
Yes.
And you know, this is just another great example that you're showing. Let's move on to this last case, because this is another fantastic result. And let's talk about this beautiful woman and what your approach was with her.
So this woman was an ex-water polo player, spent her years in the sun, and she's a native of Southern California, very afraid to look artificial, was totally against filler. I did talk her into 2 vials of Sculptra. So you can see she is more volumized on the right-hand side of the image. And basically, you know, nothing is going to, when people have that heavy sebaceous tissue in the lower face, and they have those rhytids, those are so difficult to treat, particularly in that thicker, sebaceous, heavy skin. And no matter what we put in there, Vobella, filler, it's so hard to resurface that tissue. So this is someone that I felt needed a little bit of stretch and global volume from Sculptra, but she also needed an ablative device that could kind of smooth out the wrinkling. So you can see that her perioral area is at least 50% improved. One of the things to point about the accordion lines that you say are quite stubborn, this is the problem with those lines. When you put filler in there, I mean, the last thing you want is to get more volume in this jowl. So you kind of are stuck between a rock and a hard place. So really ablating that area. On this patient, I used the 120 micron tip. I did 100. She has a little bit of hazel in her eye. She's not that fair. I did 100 millijoules with 100 density. And then over this entire perioral and accordion area, I did 80 times 2 as my millijoules. I did the stacking technique again. Mm-hmm. And I did a little bit of the stacking technique over her rhytids. And what I do is I change the shape of my, my pulse. And I love doing the squares at, you know, and I thought that was important to basically emphasize the variety of pulses and shapes that you can use. And when I really want to get into the line and build that collagen in these, I'll change it to a very thin rectangle and do my 80 times 2 stacking millijoule energy. And I just go, and it just gets right into that line. And I'm basically like etching out those lines with the echo at that high stacking pulse. And so I'll create a little tiny little line of ablation along those rhytids. And you can see in the eyes, she's significantly improved, and in the accordion lines. Yeah,
I mean, I think you gave her 15 years with that treatment. So
yeah,
amazing.
She looks good. And of course, I mean, you know, you always have to think of eyebrows and all that. So we try to take good photos, but she was really happy.
Great. Now, you know, you're in Southern California. Tell me, how do you use this device in somebody that might not have the week of downtime? Are you more going to the Genius or the LaserMD, or do you think maybe of dialing the density down with
it's
the
a good question. You know, it's funny. I think we all evolve as physicians and dermatologists and plastic surgeons, and we play around with these and we tinker. One of the things that I've kind of fallen upon in the last, I would say 6 months of practice, ironically, is a lot of people have been focusing on periocular kind of augmentation and fixing their eyes because we're all wearing masks. And I've been dabbling in lower lid CO2s kind of exclusively. And several years ago, it had to be 10 years ago, someone from Lutronic did this marvelous webinar on, you know, this oculoplastic surgeon did this beautiful kind of targetoid pattern under the eyes where you do kind of the 100 millijoules in the center. And then, you know, further out on the eyelid, it was 80, and then further out was 50. And so you got this kind of contraction of that lower lid festooning. And so I've been using the lower lid rejuvenation quite a bit. I did it on myself a week ago, swear to God. I did the echo under my eyelids a week ago. I did a millijoules of 80 and a density of 100. And I have a lot of laxity under my eyes. And I'm certainly Fitzpatrick type 3 or 4. All the girls were like, Dr. Gabriel, you're crazy. But I've seen results quite, you know, remarkably in this area, even in people with pigmented skin. But interestingly enough, for people that don't want a lot of downtime, skipping over to your direct question, I do a lot of LaserMDs. I think that the Ultra LaserMD is, used in my practice as well. And I get significant results in that. And I do like to stack those. So I tell people, you got 2 to 3 days of downtime, if that. And it's a really popular procedure. I'm still old school, Omar. I love Jesner peels. I'm still using my Jesner peel quite effectively for people that have mild dyschromia. Ironically, the Jesner peel and some of the other, medium depth peels, there's longer downtime. You have to wait 72 hours till you shed, and then it's 4 days, and it's kind of hard timing. With the LaserMD and some of the other devices like the Genius, you've got that, 3 days of downtime right in the beginning, and you're kind of one and done. But believe it or not, with my comprehensive assessment, when I really teach people that no matter what you do, you cannot get rid of a wrinkle unless we get deep. When people hear that, they're willing, based on the education I give them, to go kind of far. And so if that's the aesthetic goal of the patient, I try to encourage them, because I don't want to overpromise and underdeliver. But this area is so aesthetically driven. Most people are not walking in with a ton of rhytids already. They already have pretty good skin, and now we're just optimizing it. And so I really love to use the 300 tip for the more mild kind of dyschromic patient. And the 300 tip, like you said, is a little bit broader, not so deep, really great at getting that top epidermis off, that stratum corneum, and just kind of doing a real beautiful pigment correction, and definitely improves texture. Right. So I do that quite a bit on those patients that really don't need the deep rhytid improvement, but are really looking for a powerful kind of reset of their pigmentation.
Awesome. Well, thank you for sharing that you've used the eCO2 on yourself. And now I know why you look 21, but you have all this experience. So.
You know what? I don't do much, believe it or not, but I really wanted to do this. And here's a woman that we did with her lower lids. She looked amazing. She is a nurse, and she works at night, and she just has these really dark caves. She definitely needed tear trough volume. But honestly, I said, even if you volumize, no matter what, you're going to have that laxity and that rhytid, and those rhytids. And the hyperpigmentation didn't improve, because as we know, lower eyelid dark circles are a combination of vascularity, that's translucent through the thin skin, shadowing from volume loss. And so this picture was taken a month after her echo on her lower lids. She was thrilled, and I was as well. We did an 80 millijoules pulse of the 120 micron tip, 80 millijoules energy, and the density was 100. Right. And again, I do a kind of a double pulse right in the center to get that little contraction in the center, to get that higher coagulative effect, where you're kind of, you see actually the skin contracting. Don't you see it, Omar? Go like in, yeah. And so, and then this was, I submitted the photo pre-tear trough filler, so you could really see that echo alone did an amazing job.
Right. No, it's approaching a surgical result. So amazing. Great. Well, thank you so much. Thank you, Zena. We're going to move on. We have a lot of tremendous cases. So just in the interest of time, we're going to move on. I'm going to introduce Dr. Jacob Steger, if he could bring his mic on mute. Dr. Steger is a facial plastic surgeon, and he is a Florida native, grew up in Miami, but unlike the classic stereotypical Florida man, he graduated at the top of his class at the University of Miami Medical School. He then moved on to the University of Pennsylvania, where he completed his surgery and ENT training, and then he completed his facial plastics training at the University of Michigan, another fantastic institution. So he does, it's nice having him on the panel because, he does a lot of plastic surgery procedures, and I'm really excited to hear how he kind of combines the eCO2 with the stuff that he does in plastic surgery. He's extensively published in peer-reviewed medical journals in all things facial plastic surgery related. And his philosophy centers around delivering natural appearing results using a variety of not only surgical, but laser techniques. So he is board certified by both the Facial Plastic Reconstructive Society and the American Board of Otolaryngology, and he practices in Boca Raton. Welcome, Dr. Steger.
Thank you. Can you guys hear me okay?
Yeah. So why don't you just tell us for a minute what you like about the eCO2 and what makes you passionate about it?
So I actually have been doing, I've been using the eCO2 or the eCO2 laser since 2009 as well. And I actually have two of them. I just purchased a second one for a variety of reasons, but we do use this machine often in my office. I do at least a few of these a day. So whether it be alone as a standalone procedure, as a deeper treatment for an ablative type resurfacing, or lighter treatments like you were talking about earlier, using a 300 micron tip at a lighter energy setting, and a lighter density just to give an improvement in dyschromia. So we do that frequently. And we frequently use it with surgery. I would say about 80 to 90% of the facelifts I do. I have a very heavy aging face practice. And within that practice, mainly facelift surgery combined with blepharoplasty, kind of full facial rejuvenation. And I would say about 80 to 90% of the facelifts that I do incorporate the use of some kind of skin resurfacing, which is generally the CO2 laser. Being in South Florida, we live in an area where sun damage is kind of the norm. If someone has beautiful pearly skin, that's either because they're getting lasers or they're transplants from somewhere more up north. But down here, because we're in the sun and we have a lot of exposure, whether you like it or not, there's a lot of sun damage here. So I rarely see somebody that would not benefit from having a CO2 laser, at least in my practice down here. So like I said, I've been doing this since 2009 with this laser, and always thought it was probably one of the best lasers. I still believe it is the best laser that I own, or the best device that I own in general, from both a standpoint of efficacy and a lot of physicians look at a return on investment type thing, and you were talking about there's no consumable, number one, but number two, patients are very happy. This is one procedure that I don't ever market other than patients telling their friends about it. And like I said, back in 2009 when I started doing it, I actually built the early part of my practice on one patient who I said, let me try this laser on a light setting on you. You'll have a little redness for a couple days, see how you like it. And she sent probably 20, 30 friends from her circle to have it done when they saw how good she looked and how easy the recovery was with that. Now that was a lighter treatment. Now since then I still do those lighter treatments, but we also use the laser for much deeper ablations, much more aggressive settings, which we'll get into soon. But again, I've done probably around 27, I think almost 3,000 of these lasers in the past 11 years. And looking at our numbers, and we've had great results, very little complications to no complications with it, which is important. And again, when we talk about the settings in a little bit, I'll talk to you about, I tend to be very aggressive with this laser. Generally, people come to me, they expect surgical type results. And so I do tend to be a little bit more aggressive with both my energy delivered, and as well my density and the number of passes that I do with it. But again, we vary it depending on the patient, depending on their desires, depending on the downtime. And we have it dialed in at this point where I can more or less look at someone's skin and predict what their recovery will be like with it, and kind of give them a good guideline as far as when they'll be able to wear makeup and be out in public. But like I said, patients who come to me, are generally expecting a little bit more of an aggressive treatment and are probably less of a sell than maybe a dermatologist, you know, when talking about downtime with them. But again, we see the gamut of that. So so that's basically been my experience, you know, so far.
Great. Well, you've got some great cases to share, so let's jump right into it. So tell me a little about this woman's story.
All right, so she's this is a 71-year-old female who came to me basically for aging face concerns. She's actually she lives in New York, but she came down for surgery. So obviously you see that she has jowling, and so we performed a deep plane facelift on her for that purpose, for, you know, the heavy jowling, the mid-face ptosis, and the neck laxity, and she got a phenomenal result with that. But one thing that she would not have gotten as good of a result with is, like you said, those accordion lines, the crepiness that she has along her jowls, exactly right in there. Yes, I lift the jowl with a facelift, but she has those deep lines, as well as perioral iridids that are pretty, you know, moderate to severe in her situation. She never was a smoker, but again, you know, aging and sun exposure, and she's 70 years old. So we did a combination of a deep plane face and neck lift, along with a fractional CO2 laser to her entire face. She actually, interestingly enough, a year later came back to have a brow lift, but she did not want to do it at the same time as the surgery. So you can see I do the entire face along with a facelift, including the facelift flap. I do a deep plane facelift. So in doing so, our flap is a little hardier. There's not as much as pure skin exposed, but there are areas where, you know, you're basically down to just a little bit of subcutaneous fat on the dermis, and I do still laser that area 20% lighter than I do the other areas of the face. But again, you guys might consider it still aggressive settings. Over the flap, I will use an 80 millijoule setting with a 200 density, and the rest of the face I use 100 millijoule density. 100 millijoule energy setting with a 200 density, and I do 2 passes around. In this case, I did 2 passes around her eyes and 2 passes around her mouth area. So you can, any case that I show, unless I say otherwise, is generally 3 months after surgery. I don't like to show results anything sooner than that, because as many of you know, sometimes it could be a little disingenuous to show how great someone looks 1 week after laser, you know, when they have a little bit of swelling, and it doesn't necessarily equate to what the long-term results are. So this is about 3 to 4 months after her surgery and her laser. And you can see the significant improvement. You know, I don't think a facelift alone can achieve this result. Certainly a laser alone won't achieve these results, but the hybrid of both procedures kind of gives you that best of both worlds.
Great. So let me just make sure I'm understanding correctly. You're lasering the entire face, but in particular around the eyes and around the mouth, you said you do 2 passes.
Exactly.
Okay.
Yeah.
Great.
Anywhere where I want better tightening, I'll do 2 passes just to get the higher density. I do, and we'll show this in one of the, I think I submitted this other case, but I do sometimes use, there is a fully ablative handpiece, not handpiece, but magnetic attachment as well, the 1000 micron tip. I do still use that tip I would use that on her if she needed it. On lighter skin Fitzpatrick 1 or 2 patients, I'll do kind of a hybrid procedure where I'll do a 100% ablation pass followed by a fractional pass. So it's kind of, I call it my hybrid. And it's for people with deep iridids who don't want permanent hypopigmentation. And I have a large series of patients with that. Never had hypopigmentation. It is a longer recovery, but they do get significantly better improvement. And this is only for the peri-oral iridids, where the skin's a bit thicker and they need a higher, just a stronger treatment, basically.
Right. And talk to me a little about order when you're doing this. You're doing it in the OR. Are you doing your lift first and then the laser, right? Or okay.
So any surgical procedure I do, the laser is always the last thing that we do. So for example, if I were to do a blepharoplasty, a facelift, and a laser, it would be in that order. Start with a blepharoplasty, then do the facelift, and the laser at the very end. They do swell up quite a bit right after the laser, so you don't want that to distort your anatomy during the procedure. So I always found that to be the best way to do that.
Great. And did you treat the neck with laser, or was that just surgical?
No, that's just surgical. The neck is not laser at all. I use the laser more for dyschromias on the neck and décolleté. We would do that at the same time as surgery, although I don't treat the neck flap with because I do a full neck dissection, meaning I release the skin entirely from the the platysma, basically the deeper tissues from ear to ear. So I don't just because of the skin compromise, I don't want to have an issue there. But I will treat below that and into the décolleté, but again, more for dyschromias. I don't go as aggressive with the laser in those areas for just risk of scarring.
Excellent. I think
when we do that, so we do sometimes, if someone wants their neck and décolleté treated for that reason, because you can't go as deep on the neck and décolleté as you can in the face, because of healing issues, the type of the skin, and so in those cases, they will we'll usually follow up with a series of 3 treatments to the neck and décolleté. We'll do the first one in the operating room, and then the subsequent treatments they'll do in the office about 3 to 4 weeks apart, and that's very easily tolerable with a little bit of numbing cream.
Excellent. Great.
So you see, so this is her lateral view. Just to go back, you can see obviously the improvement in the jowl and the neck. That's facelift results. But you can see how those accordion lines, all lateral to her nasolabial folds, lateral to her melolabial folds. You can see the significant improvement in that, and that's laser. That is facelift, but that's the combination of. But you can't get this result with just a facelift, no matter how how good of a facelift you're doing, or how much you're tightening the skin, or you can't get this, pure result with just a laser alone. So the hybrid nature of it definitely gives us a significant improvement.
No, 100%. I think, it would have been a wonderful result with just the surgery, but clearly the eCO2, I think, has augmented your results.
No brainer. Yeah.
Tell me, we have some surgeons on the audience. How do you, when you're, pricing the procedure, how are you kind of pricing it with a lift and the laser? How do you bundle those kinds of things together?
As far as cost, or as far, do we get?
Yeah, it doesn't have to be exact figures. Just
we give
ballpark.
We don't. The laser portion of things makes the recovery a little bit more intensive for my staff, so it does require more staff time, questions, kind of concerns. Not significant, but and again, we have it dialed in now where the patients are very well prepared for it. But it's more involved. We give about a 10% discount off of the laser when it's bundled with the surgery. It's not that significant of a discount. Like I said, it is time and all. So yeah.
Yeah. Well, it certainly helps augment the results you're getting, and just a beautiful before and after. So let's move on to this one. This is another fantastic.
So this is actually just CO2 laser. So this is a full face fractional CO2 laser, very aggressive around the mouth. This was a hybrid, what I call a hybrid laser, where I actually use the 1000 tip for the mouth area. You can see the significant improvement in the perioral iridids. And that's one fully ablative, it's a setting on the machine. It's 115% ablation. Really want to get through that epidermis with that. We actually then do a physical debridement of the epidermis with a gauze, and then kind of like you would before a deeper type of chemical peel. And then we go ahead and do the second pass as a deep fractional CO2 pass using the 120 micron tip. So that's around her mouth area. And you can see she still has, this picture is 2 or 3 months later, she still has a little bit of redness left there. And we do prepare them when I do this, that they can have some prolonged pinkness or some mild erythema to their skin, which 100% always goes away. But you can see a significant improvement there. The rest of the face was done with a 100 millijoule energy and a 200 density of the entire face with a double pass around the mouth. And this is, I wanted to illustrate a case of just a very deep fractional CO2 laser, with a hybrid component to it around the mouth. And this is a very impressive result, I think, as far as you
fooled me, because I'm looking at it, and we didn't talk before we did this, and I would have guessed there was some sort of surgical intervention too. So amazing, amazing, great job. Good. So, and then this is just another view, just showing, you know, that aside from the effacement of these challenging rhytids, you know, you're definitely getting a tightening effect also. So
exactly, and again, that's what I'm going for. So I always tell my patients, you know, the laser is a tool like anything. You can use a tool to, you can use the CO2 laser to do a blepharoplasty if you want to. You can use it to ablate the skin. You can use it to help with pigmentation. You can use it to help it with fine lines and wrinkles. And it really just depends on how you set that laser. That's what takes, you know, the years of experience to kind of, and tons of cases to figure out the best setting for the patient and what's going to get them the best result with what kind of downtime. So, you know, and there's no, you know, secret to it. The deeper you go, the more wrinkle tightening you get. Superficially, you'll use ablative laser like a CO2, you'll get improvement, significant improvement in dyschromias. But as far as wrinkles and fine lines, it's the deeper you go, the better. Like the slides, the histology slides that you had presented earlier on, the deeper you go, the more coagulation you get down into the papillary dermis. We're going to see a much more or a much greater tightening effect rather than just heating it by this, you know, superficial nature, a more superficial treatment. You're actually coagulating that area. And like you had mentioned earlier, when I do see bleeding, pinpoint bleeding, I like to see that. That's the goal. That's my my endpoint basically. So I tell people, but the deeper you go, okay, the lighter you go, the less downtime. Good for dyschromias, not as good for fine lines and wrinkles. The deeper you go, the better wrinkle tightening, but also the longer downtime, the more redness. And the
talk to me a little about downtime. What was her recovery like?
So most of the patients, if you're doing just a full fractional CO2 laser, by about the first 3 or 4 days, they have that kind of little bit of oozy, mottly brown look to them. We actually have our patients just apply Aquaphor to their skin continuously throughout the day. Always keep a nice moist layer. And we do recommend showering early. We have you start showering the next day for hydro debridement of the skin 2 times a day. And then continuous and no soap, just a little running water, and then continuous use of Aquaphor. Usually by the 5th or 6th day, they're peeled. Or you know, it doesn't really peel in sheets like traditional type, like or chemical peels do, or old school CO2 laser. It kind of just flakes off in the shower. We do prepare them for that because a lot of patients have had other peels in the past. So they're concerned, why is this not coming off in sheets? I'm not peeling, I'm not going to get my result. So we do explain to them that the showering actually it does flake off in the shower, and that's what we want. When the skin is ready to come off, it's ready to slough off. The debridement from the shower head is going to be enough to do that. So it'll come off when it's ready, and keep it moist and just keep it clean to prevent infection. Usually by, like I said, the 5th, 6th day, they go from being the mottled brown to a very red color to more of a pinkish color by about 7 to 8 days. And at that point, we see them and they're usually ready to wear makeup. At that point, when the skin is all, you know, healed and looking okay, it doesn't have any more areas of concern. And again, this is for deeper fractional CO2 lasers. Around the mouth in a patient like this, where we did the deeper ablation, it probably adds about 2 days to that. So they were about 10 days in that situation. But for most part, most of our patients between 7 and 8 days, they're wearing makeup, and they can be more or less socially acceptable to go out.
Awesome. Now talk to me, since you're a surgeon, how did you do this case under with topical anesthesia? Did you do it under sedation?
Right. So most of my, I would say any laser I do with a surgical procedure, obviously they're under IV sedation. All our cases are under a deep twilight sleep, Ziprovan, like a colonoscopy type anesthetic, so a deep IV sedation where they're totally out. But in a case like this where I'm just doing a laser, they have their choice. They can certainly go to sleep, but most patients opt for a local anesthetic. I do a very aggressive nerve block, a V1, V2, V3 block. I go right into the foramina, into the supraorbital notch, into the infraorbital foramen, and the mental nerve. And then out laterally in the watershed areas, I do some just a local anesthetic, just infiltration. But that it's pretty impressive. I can do the same exact treatment with the same amount of, with the patient not feeling it, doing that kind of a nerve block whether they're asleep or not. The nerve block is not fun. I mean, most patients tolerate it amazingly well. Some people take a little Valium about an hour before, that they're more nervous of the shots than they are anything else. But once the shots go in, which take all about 2 minutes to finish the whole face, they feel absolutely nothing. So again, as long as, and that takes, you got to get those nerve blocks down, how to do them. But once you do, I mean, literally 3 shots on each side, your entire face is numb other than those lateral areas, the preauricular area. I do also a shot in the zygomatic facial nerve out laterally by M1, where the zygoma meets the maxillary bone. There's a little nerve that come out there, gives all that sensation out here. So we do inject that area as well. And it's a very thorough block. And like I said, I've never had, the shots suck. I tell my patients right up front, and they expect that. We don't, disguise that. If they are afraid of needles or they don't like shots, then they can go to sleep. We use Pronox very, very rarely, and that's only to get them through the shots. But once the shots are in, they feel nothing.
Great pearls. Excellent. Let's move on. So tell us a little about this case. This is a fantastic result as well.
So this is a patient who had this is obviously a combo treatment. This is a patient who had a deep plane face and neck lift, a little bit of fat transfer, and a lateral brow lift or a temple lift, as well as a full face fractional CO2 laser. She did not do her eyes. She did not want to do her eyes, and I think it came down to cost for her, and that was the least important thing for her. She didn't really care about that as much, although I would have liked to do her lower blast. But this is a good illustration of of the power of the laser, because those ritids under the eyes, that's not surgical. That's not an incision under the eye, and then with removal of skin. That is fractional CO2 laser doing that. Down below, the improvement in the jowls, the neck, that obviously is more of a surgical result. But the perioral ritids, the periocular improvement is all basically a function of the fractional CO2 laser. She's a little bit darker than the other lady. The other lady was probably a Fitzpatrick type 1/2. She's probably a 2/3. But I did do that kind of combo treatment around the mouth that I spoke about earlier, the hybrid treatment. And it's remarkable. This is an impressive improvement. This is 4 or 5 months after surgery. This is not a month or two later where swelling makes things look good. This is real final results here. So you can see a remarkable improvement. Obviously, the forehead is improved because 2 reasons. One, the temple lift. She doesn't have to lift up as much, and Botox.
Yeah, it's fantastic. I mean, she's at least 20 plus years younger. So excellent.
Yeah.
Great.
Yep. So I think we have another slide of her so you can see, that improvement. And again, a lot of that, absolutely, certainly, you're going to have a huge portion of this from the facelift. But again, there's so much sun damage in this lady that you're never going to get this kind of result doing just a facelift alone, because you'll get a great result. I'll make her look 10, 15 years younger, but you get to that 20 plus point by doing the skin resurfacing. I mean, it really just gives you that extra oomph. You're basically, fixing the body work in the car, and then you're doing that painting and polishing at the very end. And that's how I explain it to my patients. And then another thing that I think is worth touching upon, just as far as recovery, how does it change your facelift recovery when you do a CO2 laser at the same time? And it does add a little bit more recovery time. I can get just a facelift alone looking pretty good in 10 to 14 days. You probably add about a week to that time as far as when you add the laser to it. But it's so instead of being 7 to 10 days or 10 to 14, you're going around 2 weeks till they can wear makeup, hair down, and look socially presentable to go out and about. So that is something that we do, explain to patients if patients are on the time crunch as far as recovery, and most are not. When it comes to setting a time for a facelift, they usually do set 2 weeks aside for that. And now with the pandemic, we've had a lot. Actually, that it's made our lives a lot easier because a lot of patients are working from home, and they don't need to be seen on Zoom like we are here, so that they can get away with it. But it basically adds about a week, to the recovery as far as that.
Great, phenomenal result.
But a week for an extra 10 years, I think, is an easy sell.
No. I mean, clearly the the eCO2 here added quite a bit of value to your surgical lifts. So great. So I think we have another case, and
Yeah.
go ahead and tell us about her.
Yeah, so this is a lady who's in her actually mid-70s who came in for facelift. So basically she just had a deplaned face and neck lift along with the eCO2 laser, the eCO2 laser. She had nothing else, and I would have liked to do her eyes. But that's, her main concern was her neck, her lower face and neck, and those those accordion type wrinkles around her mouth and and lateral to the middle labial fold. So a combination of this is a patient I would tell with just the facelift alone, you're going to have a significant improvement. When you add the laser, you're basically going to have those wrinkles gone. And I could say that I too. I know Zena mentioned earlier that she likes to under promise, over deliver. That is my motto, especially in the area we are, where people hold you to your word and expect a lot. It is really important to kind of set expectations. But on a patient like this, I can tell her that I can get those lines 90% plus better. Here, I think we basically are at 100% if I combine those two procedures together. So again, illustrating a different patient, but the same idea of doing a combined CO2 laser along with a facelift. Now, I should probably write up my results because I've done well over combined procedures, well over 1,000 between a laser and a CO2 laser along with a facelift, and I have never had any issues of skin necrosis from that in the areas treated in the face. I haven't had any skin compromise either in those areas. In 11 years of doing that, so it is very, and that's something that a lot of us are concerned about. Because we're concerned about lasering over our skin flap. But again, we have not had any bad experience. I do mitigate the laser a little bit. I attenuate it in those areas, but that is something that many surgeons are concerned about. And I can tell you that, and I'm concerned about as well. But at this point, we've had enough under our belt where we feel extremely comfortable doing it without any concerns. Great.
Excellent. Wonderful. Well, and then this is just another view. These were phenomenal case series, just showing, aside from that one that was just laser, just the beauty of combining.
I wanted to show kind of, doing both. Now the beauty of the eCO2 laser for me is that when they ask me to show pictures, to get pictures together, this has been a very hectic time, busy time of year for us in general. And then with the pandemic increase in volume in plastic surgery, it's been even more difficult. So when he asked me the other day to get me some pictures, frankly, I was a little bit late getting to them because I just been swamped. It's very easy for me just to go into my album and just pick three or four patients and just send it away. I don't have to go through tons of pictures. What's my best picture? I literally have hundreds of pictures like this that I can show. So this laser, as when you start using this laser, it is just like you said earlier, this is the hidden gem in Lutronic's portfolio of lasers. Maybe it's not the most profitable for them because they don't have a consumable, but as long as patients are okay with the downtime, you will rarely not get a result, or I have never seen it happen where you show someone there before they come in 3 months later, let me see my pictures, and you bring them to the computer room and you show to your patient consultation room, and we show them the pictures. I don't examine the pictures before I go in there. I just have the girls bring them in the room and show them the pictures because I know there's going to be a difference. I have no qualms about that.
Excellent. Great. Well, I really enjoyed chatting with you, and it's really amazing to appreciate and see your picture. So I encourage you to write up your experience, because that's quite substantial that you've had with using this device and your lifts combined over this time period. So great. Excellent. So let's move on to the final panelist, Dr. Jill Weibel. Jill, if you could just unmute your microphone. Jill is a wonderful luminary board certified dermatologist who also practices in Miami and Coral Gables, Florida. She's the medical director of the Miami Dermatology and Laser Institute. And she also is a volunteer faculty at the University of Miami. Jill is a dear friend, and she is a amazing person. She was one of the first physicians that realized the beauty of Dr. Anderson and Dr. Manstein's invention of fractional resurfacing and the life-changing benefits that this technology has on people with burn scars and basically scarring of all sorts. And Jill was literally one of the first physicians that started using these devices on these patients. So she's a wealth of knowledge when it comes to treating these complicated patients. She is a visionary. Her practice has over 65 lasers. She's active in the American Society for Lasers in Medicine and Surgery. She was recently awarded the Mentorship and Public Advocacy for Women in Medical Sciences Award in 2017. And if I'm lucky and thankful to Lutronic for getting me away from my 2 kids tonight, Jill has 4. So she's also a superwoman in addition to being a wonderful dermatologist. So Jill, welcome.
Thank you, Omar. What a lovely introduction. I feel the same way about you. It's a special group. So thank you to Lutronic and to my co-panelists. What a wonderful webinar it's been. And I guess I'll point out just 2 quick things and we can jump into the cases. My 2 favorite things about the eCO2 are, number 1, compared to all the other CO2s, it's painless. It is my 100% go-to for kids, for older people, and for people that are having any trouble getting through an ablative fractional CO2 or erbium because of the controlled chaos, which is the theme of my life. That really has decreased the pain. The other thing, and I'll highlight it in some of, I'm going to speak a lot about scars, I know, no surprise there, is the speed, the dynamic mode, when it came out, really caught my attention. And I call it the Laser Olympics. It's almost 50% faster than any other device I have. So if I have to cover a big surface area, I'll go dynamic on my burn patients and I'll show you some of those results.
Awesome, Jill. Thank you so much. So Jill, why don't you tell us a little about this patient and your approach in treating him?
Okay, well, and so this is a 20-year-old. He's in college and an acne scar patient. And I think one of the hardest things about this age group is they want it fixed. They want it fixed now and they want no downtime. So with this gentleman, we did 2 fractional eCO2s in the summer because he had some downtime, and I will do a combination of the static mode on the areas that are the deeper boxcar scars, and then I'll do a dynamic mode over the entire face. Then when he came back for either a fall break or a winter break, we did an Infinity. I wanted to keep it in the Lutronic family. And the nice thing about pairing it up with that is when you do the follow-up, there's no downtime. And so that was after a year of 2 fractional eCO2s and 2 Infinities. And, you know, I'd still go back and treat him more, but you can see, you know, significant improvement. And it is a journey for the acne scar patients, but they're very gratifying. And one of the things I think we've seen all through the webinar is there's something special about the eCO2's volumization issue. And the pictures I have tonight are monotherapy, or at least this one's not monotherapy, but I didn't, but Lutronic. And I think you can see that thickening of the face, and that's not with any fillers. So we can.
So you didn't use any like PLLA topically or anything. This is just device based in this case.
And I think this one is just device based. And then I believe the next picture I have, I added 1 sculpture. Yeah. So then I started at the place I showed you, and now I added 1 sculpture treatment. And again, he was a challenge, and a lot of our young people are because of downtime in college. And so if I have an older patient that doesn't have downtime, I might combine the sculpture at the same time. But so that's his final result. And I think, you know, you still could have gone more, but he was happy. And again, the picture on the left is after the devices, and then you add the Sculptra. But that's why I wanted to highlight this case.
Yeah, no, it's a great result, and I mean, I think you took it from the severe acne scarring category and you know and moved them up quite significantly. So amazing. Well, I think you have 9 cases that you've been kind enough to share with us. So so let's move on to this next case. Tell us a little about this patient.
This one we can do really fast, but I thought both of Dr. Gabriel and Dr. Steger did a great job on severe wrinkles. I wanted to bring this up because this is happening more in my clinic and probably everyone's. We are now entering the area of preventative aging. And so this is a patient who's in her mid-60s, and we will come in and, you know, she keeps up with her injectables. She has not had any surgery, and we do an eCO2 every 1 to 2 years. And this is a paradigm shift for me. And actually my patients pushed me to it, because I tended to do a big CO2 laser treatment, and then I would do follow-ups with different lighter non-ablative devices, the Infinies. But it was my patients that said, let's do a CO2 once a year. And I just want to highlight that you can get patients to their 60s and 70s with beautiful luminescent skin and no wrinkles. So that's really why I share this case, because she's been a dedicated eCO2er over the years.
No, that's a great pearl, and you know, I think all of us would love a recurring patient that would come to us once a year for a maintenance treatment like this. So great tips. So here's just another view. So here's another great challenging therapeutic condition. So tell us about this patient. Obviously, they had some pretty severe acne, huh?
Yeah, so this is one of those, and any of my dermatology colleagues on the call, Omar, you can help. This is, I believe I would call this an, you know, HS, acne tetrad, has cystic acne, had hidradenitis suppurativa, pilonidal cyst, that just horrible acne. He's in his 30s, and this was after 3 or 4 rounds of isotretinoin. So this is that PIH and PIE, post-inflammatory erythema, post-inflammatory hyperpigmentation, probably still some active HS that we see. And he's devastated because he's young, he wants to date, he wants to go to the beach. So this is a combination therapy, but I wanted to pull this out again to show that you can make improvements. And when we talk about scars, we're always talking about improvements, not perfection. Mm-hmm. So I started with a photodynamic therapy to kind of quiet down the hidradenitis suppurativa that's still active in the upper shoulders. And then I went on to do a fractional ablative eCO2 and an Infini. And, you know, you can see still there's scarring, but he was happy with just those 3 treatments. And again, you can go on and continue. I would do more rounds of eCO2, maybe some punch biopsies. And you can get to the point where, you know, these patients can walk, you know, play a basketball game without their shirt on, and they won't have to face what they had prior.
Yeah. So Jill made a couple of important points here for the non-dermatologist. One, you know, with this kind of severe acne, you know, this patient needed isotretinoin, and I think she said 4 courses of it. But even with that, I think she had to use something called photodynamic therapy, which is one of the things some of us dermatologists keep in our back pocket to get severe acne under control. But clearly a complicated medical derm issue that requires you know, not just management of the condition, but then, you know, having these devices to come in afterwards to help these patients deal with the aftermath and the scarring and the psychological impact. You know, this is something, you know, I think that, you know, when I think of dermatologists that have really led the way in, you're definitely on that short list. So, you know, it's a great case to share with the audience.
Thank you, and you as well. This is another, again, keep it electronic family. This was a art curator. He's in his late 70s. And, you know, don't forget the men. I always say, you know, men want to look just as handsome and be healthy as women. And as a lot of us that live on this panel or in sunny places, the other thing that we haven't really spoken about tonight is not only are we improving the cosmetics of patients and decreasing the wrinkles, we're also preventing skin cancer. There's really powerful studies that show doing ablative CO2 lasers has a real role in preventing skin cancer. And I think a lot of that has to do with inflammation that you get and taking off the actinic layer and the actinic damage. But he's an art curator. He had never done anything. And we did a fractional blade of eCO2, and then we followed it up again with 2 Infinity treatments and you can see again the volumization improvement, and minimal downtime. But I just wanted to bring a man into the fold tonight.
Yeah, no, this is a great case, and I love, it kind of hits upon how, with a device like the eCO2, it takes a little more downtime, but you can sometimes, some of the results we get are just phenomenal. But then, when they come back, if they want a little more oomph, you can just move them over to the Genius, or the predecessor to the Genius was called the Infinity. But that's the great thing about this company. They have a portfolio of products, and really you can kind of fine tune the downtime. But the eCO2 is just such a versatile device. So this is getting into one of the things that is really some of the most amazing work you've done. Tell us about this woman with this burn scar and her story.
So I think the final 3 or 4 cases I pulled from one of my favorite clinical trials we've ever done. This was an early intervention burn study done with monotherapy, 3 treatments with the eCO2. So the rest of the cases that I share with you are all from this study. And this patient was in a fire in her home and was severely burned. And all of these patients were treated in my office within 3 months from their injury. So they were basically released from the burn unit and came straight to my office. And this was after 2 treatments that you saw this dramatic improvement. And I published this article and this study. But I think what you can see, and for those of you that have heard me lecture, I'm usually like, well, you should use a laser for the vascular, and then a CO2, and then a laser assisted delivery. But in this case, it was monotherapy with the eCO2, and you can see you do get blood vessel improvement. I think the most poignant improvement with her is her ectropion. And I think if you move to the second slide, thank you, Omar, right on point. Look at that improvement with that ectropion. And I do believe that early intervention is the key with scarring. We do know with any scar, they tend to become hypertrophic or cause contractures 2 to 6 months after injury. And that can be true of a surgical scar or a burn and trauma scar. So I find when you get it in those first 3 months that they're more pliable and they respond faster. And so this is a great example of changing lives of patients with the eCO2.
Awesome. Great. Thank you so much, Jill. This is amazing. So here's another one I think we can go over pretty quickly, but another burn scar patient. Let's hear a little about what happened in this scenario.
Yeah, this was a worker on the job explosion injury. And again, this was 3 treatments with the eCO2 in this study for early intervention, got within 3 months. You can still see a little bit. And normally when patients come to consultation for these significant burn and trauma, I'll tell them it could be 6 or 7 treatments. So again, I think you can see still some textural issues, but significantly better.
Great. And just like you said, just to hammer that point home, you can see the vascularity and the improvement in that. And this is simply just the eCO2 device. Great. So go ahead and tell us about this one, Jill.
This lady, she's a firecracker. So she was smoking with her oxygen tank, one of our no-nos. And so this was exploded on her face. And this was actually a split where control was the other side, but you can see right under her nose is where I didn't treat. And I would have expected horrific scarring, and she's older, and we think of, older patients don't heal as well. She had an amazing improvement and really no significant structural damage after this severe burn. Now we just need to do the lower face for the rhytids.
That's right. Awesome. And then this case.
Yeah, another, this is one of my favorite patients and just really was burned. He was almost 100% body surface area burned in a fire, and 3 treatments. And I think also what I would point out is, had this not been treated, and Omar, I know you do a lot of these cases and have seen it, like he would have developed contracture in his arms in a way that he wouldn't have had any range of motion. And again, that's 3 treatment sessions. And, you know, these really not only help the cosmetic improvement, but the functional improvement, the range of motion. And then another area I've been very passionate about is it also decreases itching and pain in these patients. And that's something that we didn't always ask about, but burn and trauma patients in particular can have 10 out of 10, both pain and itching for up to 3 years after injury. And the CO2 laser not only works on collagen, but on the nerve fibers and all kinds of other magical things.
Mm-hmm.
How are you anesthetizing these patients, Jill?
Well, it's interesting. So the eCO2, as you know, is really not that painful.
Yeah.
But what we usually will offer them, I have the Pronox, which has changed my practice. And then I also do midazolam based on their weight. It's usually less than 10 cc's. I underdose. And if they want, I'll do 1 Tylenol 4. But most of the time with eCO2, you don't even need the orals. But if someone has PTSD or they're younger, they're nervous about it, I will offer the oral meds. Of course, then they can't have a driver. But today with, you know, we usually set that up. But honestly, eCO2 is very well tolerated.
And what are your settings for like this gentleman all over his body? Are you doing the, are you doing the lower density? What are your settings to really break up that scar tissue?
Well, the first thing I do is I have an OCT, and I've published on this in optical coherence tomography. So I will take a few settings and see how deep the scar goes. And then I will titrate the laser settings based on the depth. Normally with burn and trauma scars, they're between 500 micrometers and 900 micrometers. Now, if they're really, really thick hypertrophic scars, they could be as deep as 2 centimeters. And then I will a lot of times start with a static mode, and, you know, I'll do 100, you know, I use the 120 tip, and I'll usually be in like, you know, again, based on depth, I might be at 140, 160 millijoules. I'm pretty aggressive, and I'll hit the hypertrophic areas with static. And then I do dynamic all over, and, you know, I might be in the 120, 130 range. And that works very well.
And is your density 100 too?
Yes. Yeah.
Got it. Yeah. Beautiful. I'm so impressed by the vascularity.
Yeah, you know what happens, and I have been too, is that you're vaporizing those vessels. I mean, you coagulate those vessels with the CO2. You know, you don't get those same results with other devices. Erbium, you bleed, but CO2, you coagulate. And I think we've seen that not only with the ablative fractionals, sometimes we even see it with the non-ablatives, but it's, but anyway, I think it's the key.
And that's a great point, Jill. Maybe you can talk a little bit about that. The erbium versus the CO2, and when you're treating burn scars or in general, maybe even for rhytids and things like that, how do you select between those 2 wavelengths?
Well, you know, it's hard. I always say, it's like you said, I have 4 kids. I mean, I love all my lasers, and I think they each have a place and a role. So, you know, erbium and CO2 ablative fractional are, I think they both work beautifully. The erbium is very loud, the one that I have, and it does not have coagulation. So it's has a lot more oozing and bleeding. And so, you know, you have to choose the patient that can handle that. So if you have a 6-year-old with post-traumatic stress, I'm not going to pull out that laser. The sounds, the smells, the bleeding is going to be scary. So again, the eCO2 is my go-to for kids, for big cases, because I can use that dynamic mode and move quickly. And for people that are maybe not as good with the pain. Now, for cosmetic patients, I've become a little crazy over the pandemic, and I used to be more of an erbium fan around the perioral, traditional erbium. And then I always use eCO2 or CO2 around the eyes, and put eye shields in and hammer it, because I think you need the coagulation on wrinkles on thinner skin. But during the pandemic, I've gotten crazy, and I do full traditional erbium, and then I put CO2 on top, and I've had some of my best treatments, improved treatments ever with wrinkles. So, you know, as long as you understand laser tissue interactions, I think combination treatments can be very powerful.
Awesome. Great. And I think we have one more case for you to share.
Yeah, again, this one has a little more PIH, and it's still an early burn scar, and it's around the abdomen. And again, one of the things I know when I was starting out many years ago is I was like, you know, what areas can you treat? And I think I've treated a scar literally on every part of the body. So this is an abdomen, again, 3 treatments, with early intervention within 3 months of the burn area. And you can see the scars just start to melt away. And again, 3 treatments for burn and trauma patients is not that many. So again, imagine another 3 on top of this, and you can improve patients almost 90%. And I think that's really exciting because these lasers really weren't meant to help scar patients, and they're an absolute game changer.
Wonderful. And then, I misspoke. So here's another one, but this is, I guess, a little bit of the inverse. Why don't you tell us about these scars and what they're from?
Yeah, so this is the graft site. This is the donor site of a burn patient. And one of my goals in the next 20 years is that there will never be a graft site again. And I'm doing some research that, because what's happening now is that our burn and trauma surgeons are so amazing that they can save almost anyone's life. And that's true in the military. I work a lot with the military, as a lot of the panelists do. So, but if you get someone that has a 50% body surface area, let's say from their waist to their head, then the answer or the solution is often to take donor normal skin to graft onto the burn area. And so this is an area that was the donor site. And sometimes this isn't bad, but sometimes the donor sites scar worse than the burn areas.
Right.
So I think in this case, this was just 1 or 2 treatments in dynamic mode, very lightly. And it gives the patients a lot of hope because they can see right off the bat that there's massive improvement, and you can blend that. And I always encourage people to treat the donor sites, not just the burn areas.
Great. Excellent. And so, Jill, thank you so much. I want to thank the panelists, Dr. Zena Gabriel, Dr. Jacob Steger, and Dr. Jill Weibel. You've gotten to hear from 3 very different physicians, one that practices in Southern California with some very high maintenance patients, a facial plastic surgeon in Florida, and Dr. Weibel, who treats very complicated burn scars and other conditions. And I think that's the fact that all 3 of these different physicians are all passionate about the eCO2, and you can hear when they're each talking about the device and what they're passionate about, having the dynamic mode and talking about the device and using settings that go down to what they're trying to target. You can see that the device has the flexibility of not only going down to treat things like tone and texture, but going down to treat things like deeper rhytids and static rhytids and complicated burn scars and acne scars and things like Rhinophyma. Really shows you the flexibility of this device. And I think Dr. Steger was the one who mentioned it's kind of like a hidden secret. And, I feel the same way. This is just a really reliable device for me. So, with that, I want to thank you so much for your time and attention. And I'm going to turn this back over to Dan Sullivan from Lutronic to close out.
Thank you very much, Dr. Ibrahimi, and thank you very much to all the incredible panelists this evening, Dr. Gabriel, Dr. Steiger, Dr. Weibel. That was an excellent, extremely informative presentation. Lots of pearls and tidbits. I think everyone learned a lot tonight. Just such a great comprehensive overview of this really exciting technology. So really can't thank you enough. I'd also like to extend a thank you to our excellent audience for attending this evening and for their very insightful, intelligent questions. As I mentioned at the beginning, please don't worry if your question wasn't addressed, although there was so much talked about tonight. Dr. Ibrahimi did a masterful job of weaving in your Q&A throughout the conversation. So if there is anything else you want to ask about, though, feel free to email me. My address is on the screen, dsullivan@lutronic-usa.com, and a team member will follow up with you shortly. As a reminder, this presentation was recorded and will be available on demand at lutronic.com very soon, and we will keep you posted on that. Thanks one last time to everyone. Have a great night, and we look forward to talking to you all again soon. Take care and be safe. Thank you.